afternoon and welcome to our session today. Training code SHMMUP008 Apply Eyelash Extensions. My name is Juliana and I am going to be your trainer today. So I'm a beauty therapist, makeup artist, nail technician, eyelash technician, scar, stretch mark, conceal artist, and I have over 33 years in the industry. So to start off with today, I'd like to acknowledge country. So I would like to acknowledge the Whadjuk peoples as the traditional custodians of the land we are meeting on today. It is upon their ancestral lands that Quality Ed is situated. I also want to pay respects to the Whadjuk elders past, present and emerging, and extend this respect to other Aboriginal and Torres Strait Islanders present here today. So we've got our acknowledgement of country. Just very quickly, evacuation and emergency procedures. So in case of emergency, if you just head out the door, turn right and you're out on the front road, and turn left and you'll be out on the laneway. When you get out there, the muster point is actually on the road and you will see emergency wardens, fire wardens all out there for you. Bathrooms, toilets, again, out the door turns to the left and it's the first door in the corridor on the right is your bathroom and toilet. So just a couple of house rules before we start. Turn off mobile phones. No chatter whilst lecturer is talking, no interrupting, and please use courtesy and be respectful of everyone in the class. If you need to take an emergency call, please step outside to do so, just to not disturb anyone. So again, no mobile phones, no talking, and of course no talking on the phone in the classroom. So a little bit about you. Tell me a little bit about you, Valentina. We're doing a one-on-one session today, and I do understand that English is your second language. So what I have actually done to support you with your learning today is I've actually included subtitles and voice recognition on our PowerPoint presentation. So if there's anything that you don't understand or anything that I'm saying that you're not comprehending, there is the subtitles at the bottom, but by all means just pop your hand up or just stop me and I can explain to you in more detail. So tell me a little bit about you and why you're here.
My name is Valentina and I'm a beauty therapist and I want to learn how to do lashes.
Okay. And have you had any experience with lashes before? Once, okay. Alright, so to start off with, I do have a course training manual, so you can actually follow through with the PowerPoint presentation through the manual, and there will be things throughout the course that we will actually be referring to. There'll also be handouts and extra sheets that you can put into your training manual for reference later, for studying, and just to go back over what we've learned. In this session, it's Introduction to Eyelash Application Extensions. We're going to go through contraindications, identify different eye shapes. We're going to go into the different lash curls, the lash length, different materials that the eyelash extensions are made of and what the differences are. We're going to start preparing to actually do the lash mapping, which is basically a guide on how and what sizes and where you're going to put the lash placement on the eyes, and we're going to go through the industry regulations. So first of all, what are eyelash extensions? Okay, eyelash extensions are semi-permanent fibres that are glued to the natural lashes to enhance their length and fullness. Each lash extension is meticulously applied to a single natural lash. The goal of lash extensions is to give the eyes a made-up appearance without the use of mascara or other makeup. What's the difference? Okay, so false lashes usually come in strips that you glue across the top of the natural lash line and remove them at the end of the day. The eyelash extensions are individual fibres, either in singular or cluster form, and they're attached to each natural lash one at a time. Once applied, the eyelash extensions should last the average lifespan of natural eyelashes, which is about between 3 and 6 weeks. There you go, so which ranges from 6 weeks to 2 months. 2 months is extreme. I think if you were to have your eyelash on for 2 months, your extension would be way out front. So generally, the hair growth cycle will range anywhere from 3 weeks up to 6 to 7 weeks, and then they will fall out themselves. So different types of lash fibers. So we have synthetic, silk and mink. So synthetic are obviously man-made, so they're made of a polished acrylic material. They're the firmest and sturdiest of the eyelash extensions. They come in a variety of thickness and curls, and they can be applied to look very natural. These are the most popular with the ladies wanting a more dramatic and made-up look, because they are thicker and they are darker in look. They do have a more dramatic look. They hold their curl extremely well due to their firmness. So with your eyelash, this type of eyelash extension, you would not apply any kind of heat to curl them more, or even the lash curlers, because they are a plastic. So A, you will melt them, and B, you will actually you'll crimp them, so they'll go on an angle. So we have silk lashes. Silk lashes are mid-weight. They are finer and more flexible than the synthetic type. They are a better option if the natural lashes are very weak or fine. Okay, so if your natural lash is not actually strong enough to hold an eyelash extension, then the silk materials are a better option. They also come in a variety of lengths and curls, and then you have mink. Okay, so there's actually two types of mink lashes that you can get. There is real mink, and as much as, yes, there are mink farms, so they farm the mink, cat, animal thing, and they actually brush its tail to get the mink fur from its tail. However, the farming doesn't necessarily guarantee that they're being looked after. So here we're actually cruelty free, so we won't be using any type of mink lashes. But then you also have your fox mink lashes, so your fake ones. So they're very fine, very soft and very silky, which equals very much more expensive. Okay, so for people wanting mink lashes, they need to be prepared to pay a higher price range for them. When they're wet, they actually become very straight and wispy. So these are the type of lashes that you can then apply heat to re-curl them, or the clamping eyelash curlers. It does take longer to apply mink because they're very, very fine, and you actually need to apply more lashes with that. The different types of lashes when it comes to actually application and different looks. So we have the classic, the hybrid, the volume and the mega. Classic is what we're going to be doing today. So the classic is one singular lash attached to one natural lash. Okay, so it's individual or one-to-one lashes. It's the most traditional style, and it is the most natural looking. You can still have different lengths, different curls, different thickness, but it is the most natural looking. Going on to that, we have hybrid. So hybrid is a combination of a volume fan and a single classic lash. So volume fans are clusters, so they're clusters of individual lashes, and they're actually glued into a cluster, and they range, as you can see, anywhere from two lashes, so a 2D, right up to a 20D, and they actually do go further than that as well. So you doing a combination, so alternating a cluster and a single lash, you're actually creating hybrid lashes. Okay, so it's in between classic and it's in between volume. Your volume lashes, you're just using clusters, so any clusters anywhere from a 3 to 4D up to a 15D. Again, it's a heavier look and it's a more dramatic look. If someone has lashes that are very fine and weak, you can still have a volume look, however you would use a lower cluster. So you would create volume with lots of application of a maximum of 4D, 5D. So it can actually still, the natural lash can still hold the cluster, but it's not too big that it's going to weigh it down too much. Thing with having a lash extension, a high cluster on a very fine weak lash, you actually risk the natural lash falling out, and when it's being pulled out and it's been falling or pulled out unnaturally, it can actually damage the hair follicle. In damaging the hair follicle, you're actually preventing another lash from growing completely, so it's a big no-no. And then we have the mega lash. Mega lash is not, look, it's popular among the young girls today. It's a very, very heavy lash on the top, and those lashes again are clusters ranging anywhere from a 6 to 8D right up to a 16 to 20D. Again, not good if you have fine lashes, but ideal for, you know, photographic work or a special occasion, a wedding or anything like that. Okay, so we have the curl lengths and shapes and the different fans. So this is what I was saying about the fans. You have a 2D, which is 2 lash clusters, all the way up to a 20, and then you have your different curls. The most popular curl and the most natural curl is the C curl. With your mega volume, the most popular curl for that one is a D curl. Because you are putting so much more lashes on, you need a stronger curl to actually lift the lashes up, otherwise it can make the eye look too tired. So here's your differences with your curls. So you have a B curl, C curl, D curl, L curl, and M curl. Now as you can see, the L and M actually kick out, so they come out and up. Really good for someone with a monolid. So monolid is your smaller, flatter shaped eyes, because it can actually create the appearance of lifting the lid and pulling it up and out, so really opening up the eyes. And then obviously there's going to be contraindications when you're doing lashes. So it's really, really important to assess your client before you start doing lashes. You know, it's important to ask questions. When you're filling out your client form, you want to not only ask questions, but you really need to find out if they've had any recent infections, if they've recently had conjunctivitis. All those sorts of things are different types of contraindications. So we have the style, alopecia, which is where your lashes are falling out, blepharitis, which is, it's not conjunctivitis, but it is a crusty residue that's being left on the lashes. Okay, lice and mites, trichotillomania, it's when people are actually pulling out their eyelashes, herpes and conjunctivitis. So they're all the main contraindications when it comes to applying eyelash extensions. Of course, the other one that's not listed there is an allergy. So if they have an allergy to the glue that you're using, or a particular glue or anything like that, there's not a lot you can do, and it becomes a contraindication to actually applying those. So allergy versus irritation. What's the difference between an allergy and an irritation? So an allergy is an immune reaction causing redness, itching, swelling and puffiness, and it will usually happen within 24 to 48 hours of eyelash application. So it can take a little bit of time to actually come out. It's not an immediate reaction. And an irritation is a milder reaction causing similar symptoms but without an immune response, usually easing within a few hours. So having said that, an allergy will take 24 to 48 hours to come up and present itself. An irritation generally presents itself immediately and will subside within a few hours. So common causes of allergies are, so it's basically an allergy to the cyanamide, cyanoacrylate, which is the glue. It could be a reaction to the colour, the tint, if you're using the tinted glues. And I have actually personally seen myself irritation to the eye pads that you put underneath, and also the tape that you're using to tape up, that can actually cause irritation. So if someone has a reaction to latex or nylon, they can very well be allergic to the tape that they're using as well. So with the irritation, what causes irritation, your iPad is sitting too close to the eye and it's actually rubbing on the eyeball. I generally ask my clients not to talk too much while you're doing the lashes. Just the general talking actually causes the iPad to move and scratch and irritate the eye. And then of course you have to keep adjusting that, which then causes more irritation. The fumes, so always tell them to just keep their eyes closed until you've completed the treatment, because it is a resin glue and it does have a smell to it. And again, improper iPad or tape placement, so we said that. So the resolution, okay, if symptoms persist with the glue being the cause of your allergy, basically recommend that they don't get an eyelash extension, eyelash extensions, and they possibly go for a lash lift and tint instead. And that way they're still getting a natural look, and it is a little bit more permanent. Otherwise they just have to opt for the false lashes that they apply every day. And when it comes to the lash and tape and eye pads, you can switch to other products. The eye pads under the eyes generally are just to hold the lower lashes out of the way and in place. So you can use tape instead of eye pads. You can use wet tissues instead of eye pads. So there are other options. And as far as tapes, there are lots of different materials that tapes are made from. So from your plastic to your latex to, I've even cut up Band-Aids when someone was allergic to the tape. So literal Band-Aids that you put on your finger when you cut them, you can actually cut them up, peel them off and use them as tape as well. So irritation, so encourage clients to stay still, as I said, and with the glue-free fumes, make sure they've always got their eyes fully closed. And again with the iPads, just assess how you're touching, how you're placing them, and how much movement there is. You can also, when you're placing the iPads, you can actually tape them in place to just prevent some of that movement. And the other thing is just eye drops. So recommend that you can either do an eye bath, recommend they do an eye bath the following day, recommend them to some anti-irritation eye drops that they can apply after. Okay, so it's also important to always advise your clients to seek medical professional advice if symptoms persist. So if the irritation hasn't gone away within 24 hours, ask them to seek medical advice because it could actually be an allergy instead. So you need to follow that up. Again, the differences, you can actually see symptoms of an allergy. You'll generally get puffy, itchy eyes, watering, swelling, and the bloodshot eyes. The symptoms of irritation, generally just very watery, red bloodshot eyes, a little bit of stinging, even sometimes you get like a scratchy feeling. Okay, so that's the difference. And again, going back to allergy and irritation, it's super, super, super important to perform a patch test on your client before you begin. So what I have here is the material safety data sheets. So these are the safety data sheets for the products that we're going to be using in this training course. So pop them into your training manual, and that is something to go back on. It's also something that you might want to keep on hand in your salon. So when you are performing a patch test or someone has completed their client consultation, you can actually check if they're allergic to any ingredients that are present in the products that you're using, and you can find an alternative. Okay, so do you have the practice kit that you purchased from Glow with Gigi?
I think so. Yes.
There it is, excellent. Okay, so we're going to pull apart that. So we'll just pop this out of the way. So we're going to pull apart that practice sheet. We'll pop this at the back. You can pop those in as part of your homework. So, open up, what have we got? To perform the patch test chart. Okay, so doing a patch test, we're actually, we're testing the glue, the tape, the iPads, the shampoo if it's in there, super bonder, we're not using that today, and the alcohol wipes. So let's pull this apart. So here's your glue, so you can open that up. There's your tapes, and there's your alcohol wipes. And we'll use these, we're going to use these for the iPads today for our mapping. Okay, so when you're doing the patch test, as you can see, we're actually going to draw a grid. Did I draw it there? No. We're going to draw a grid on the inside of the arm, and you're going to actually apply these products in this order, set a timer for 30 minutes, and from there, after 30 minutes, you go back, assess the area. If there's any redness, itching, bubbling, blistering, anything like that, you know there's a reaction happening. So, and then you can pop that down there. So, starting off, I'm going to do myself, and you're going to do a patch test on it yourself. So you're just going to fill that 1, 2, 3, or you're in a hurry. Oh, I did too many lines. 4, 5, 6. I did too many lines. So just 4, 5, and 6. Okay, so number 1, I'm going to put a drop of glue on. You can wait. You're in a hurry, Valentine. You don't want to wait for me today. So we're just going to, maybe not. Number 2 is the iPad, so we're going to use that one. Three is the alcohol wipe. And number 4 is the tape. So let's get a timer happening. And a piece of tape for you, so just stick that on your arm. Okay. So generally while your client is having the patch test done, just offer them a tea or coffee so that they can sit and relax. And and we can go through, you can actually go through I think there's a rubbish bin just down below. Can you just pop those in there? Thank you. So you can go through the client consultation once we do that. So we'll just pop this out of the way. That can go in the bin. We're going to come back to this kit a little bit later on. Sorry, pop that down. Just put that out of the way for us. Okay. So again, when it comes to patch testing, it is an important practice. Okay, it covers you for a lot of areas. So not only just allergy and irritation, it's your duty of care to your client as well to make sure that she's safe and you're not using any harmful products. It also comes down to your insurance. Okay, so unless you performed a patch test, it's very hard to get your insurance company to cover you should something actually happen. It also helps you go back to your material safety data sheets. So if there is an irritation, you can actually cross-reference with that to see what ingredients they are part of. When it comes to legislations, you need to contact the Department of Health to go through the sterilising and maintenance of cleaning equipment. And then also, it's best to actually check with your local government, so your local councils for their legislations regarding if you're working from home or even if you have a salon. Go through the different eye shapes. So we have small eyes, wide set eyes, close set eyes, downturned eyes, deep set eyes, protruding eyes, and round eyes. So as much as there's a lot of different eye shapes and there are a lot of different factors that relate to the different eye shapes, underneath all of these, which you do have in your manual, so page 17 in your training, we actually do have the type of curls and the type of lashes that suit these particular eye shapes, and it also gives you a little bit of a guide on how to actually identify and determine each shape. So when you have identified the shape, we're going to go through the 3 most popular lash application styles, and starting with number 1 is the cat eye. So as you can see with the cat eye, it starts off with a shorter lash on the inner corner, and it actually comes up high. The length of the lash peaks just past the body, like the main body or arch of the eyebrow. So the highest point lash peaks just past that, and then it comes back down again, creating that lift and the real angular almond eye. So that's the cat eye. Next one is the doll eye. The doll eye is really good for small eyes and also monolid eyes. Basically, it is a shorter lash on both the inner corner and the outer corner, with the highest lash at the peak, which is just at the beginning of where the brow arches, right through to the end of the brow arch. So in line with the pupil is where you want that cluster of lashes to be the longest, and that's really going to lift the eyelid up and open up the eyes a lot more. And then we have the kitten eye. So the kitten eye, again, very similar to the cat eye, but the kitten eye is actually otherwise known as a natural, or the squirrel. Again, similar to the cat eye in the sense that both starting very short at the beginning in the inner corner and then finishing short, but it's just the peak of the lash is at the brow arch. So the peak doesn't extend as far as the doll eye. So the doll eye extends at the beginning of the arch to the end of the arch. This is quite literally center of the arch. So they're your different cat eyes. So I just want to go back. Okay, so as you can see, the cat eye, it's at the end of the arch. So you've got the eyebrow arch here, and at the very end of where that arch is where your highest, that's where your longest lash is going to be. And then as you can see with the cat eye, that longest lash is actually at the top of the arch. So it's actually going to bring the eye open and wider without dragging it sideways. So to create the kitten eyes, we've got all the different shorter in the middle, going up, highest point at the arch, and then like fading off to lower at the end. So what we're going to actually go through now, we've done our patch test, the different eye shapes. So we've got the round, protruding, almond, Asian, hooded. So we've done all of that. So are we all good with understanding the different eye shapes? Yeah, the different curls, different materials of lashes. Good. Regulations, patch testing, we're all good with that. Okay. So as again, going back to your training manual, which is here, we're going to go through a client consultation form. From that client consultation form, we are then going to select what type of eye shape we are identifying with them, and from there we're going to select the best possible mapping technique to best enhance their features there. So I do have the client forms as well, which are actually at the back of your patch test chart. So we will complete that when we get back from the break. We're going to have a quick 5-minute break now, and then when we do come back, the next session we're going to do our client consultation, and we're actually going to start mapping for different eye shapes. Going back to your practice kit, we're going to be using the mannequin heads. So we're going to be mapping on the mannequin heads for that today. Okay, and then we're going to go through different types of tweezers to use, different equipment, fans, pads, mirrors, all that sort of thing. So let's go have a nice quick break. Again, bathroom's just down out the door to the left, down the passageway first or on the right, and we'll meet back here in about 5 minutes time. Thank you.